As a father of 5 myself, I know just how distressing and inconvenient it can be when a child falls sick. You're not quite sure how bad it is, and you want reassurance that your child is going to recover as quickly and as comfortably as possible. So what can you do to make sure that happens? As a GP, I know that there are so many variable symptoms that can afflict your child. They might come home from school with a streaming nose or a cough or a cold. Could be a tummy ache, a rash, or diarrhea and vomiting. How do you know whether something is really significant? And I think the first thing to do is to follow your instincts as a parent, because you know your child better than anybody else. You can get a pretty good idea about how they are by assessing their appetite. If they're eating normally, that's a very good sign. And if they're active and alert and they have the usual amount of energy, that too is a good sign. If, on the other hand, they're not eating and they're not very active either, that's a sign that there may be something that's going on. The commonest things that occur are coughs and colds. So treat it symptomatically, see if you can ease that cough, and look out for any sign of a fever that doesn't abate with something simple like paracetamol. Amongst the commonest symptoms, of course, there'd be colds and coughs, streaming nose, ear pain, maybe throat pain, difficulty swallowing, but tummy pain and rashes as well. It's sometimes very difficult for any parent to know just how sick their child might be, and things can change quite quickly. They can sometimes get better very quickly after a simple dose of paracetamol, or things can evolve and get worse. There are certain symptoms, however, which do indicate that something might be more serious and require the advice from a healthcare professional. These are what we call red flag symptoms, and might include something like persistently high fever, which doesn't get better with simple treatment. It could be persistent tummy pain or diarrhea. It could be a seizure, which occurs for the first time. And of course, we're all concerned with meningitis, which isn't common, but nevertheless can be life-threatening at times. So look for cold hands and feet, a fever, neck stiffness, vomiting, and a rash that doesn't fade when pressed with a glass tumbler. If you suspect any of these things, then call for help. Either call an ambulance or at least call 111 for further advice. As I said earlier, trusting your instincts as a parent is really important. Don't be afraid to call for help, because that's what we're there for. And if you don't think it's bad enough to be an actual emergency, then why not think about calling in to see your friendly pharmacist at the co-op, because that's what they're there to do, to help you.